Let's be honest, your shift starts before you even step foot on the unit, and what you wear can really set the tone for the entire day, and that is why I love FIGS. Back in nursing school, I wore those standard boxy scrubs that felt like a scratchy paper bag, but not anymore. FIGS are so much better. They're flattering, they're super comfortable, and they're designed for people who actually work in healthcare. Plus, they're antimicrobial to help keep you protected. They're durable enough for endless washes and stylish enough that you actually want to wear them. If you're new to FIGS, I recommend starting with the Catarina top and the Cade pants. The Catarina has a relaxed, easy fit that's perfect for moving through a shift, and the Cade's cargo pockets keep all your go-to supplies within reach. You can get 15% off your first order at wearfigs.com with the code FIGSRX at checkout. That's wearfigs.com, code FIGSRX for 15% off. I love layers. I have so many sweaters, cardigans, and jackets in my closet that I seriously get excited when the cold weather hits. And even though I have plenty of coats, I could not resist adding another one. The stretch crepe trench coat in black from Quince. This is the sort of coat I can throw on over leggings to run to the grocery store without looking like I'm in my pajamas, or pair with trousers for a chic, put-together look anytime. Quince has it all. $50 Mongolian cashmere sweaters made for everyday wear, soft denim, leather accessories, and of course, coats. Lots and lots of coats. It really is the perfect place for gift giving or upgrading your own wardrobe. And since Quince works directly with ethical, top-tier factories, the prices are 50% less than similar brands. Step into the holiday season with layers made to feel good, look polished, and last from Quince. Perfect for gifting or keeping for yourself. Go to quince.com/nursemo for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. This week, I'm sharing my best tips for having a great start to your shift, whether you're a nurse or a nursing student in clinical. And before I get into it, let me tell you a little story. So a little story time here. I was orienting or precepting a new nurse to the ICU. They had some experience in telemetry, but new to ICU. So of course, I'm not working with a brand new nurse, so I definitely trust his instincts, trust his ability to be a good nurse, because obviously he was, or he wouldn't have transitioned over to the intensive care unit. But that start of the shift was always a little bit rocky, and it always is, right? Start of shift, anything and everything can happen, and it really does set you up for how the rest of your day or night is going to go. If it starts out rock solid, you generally can anticipate things continuing along that path, though of course not always. But if it starts out shaky, you can definitely anticipate the entire rest of your shift being very, very chaotic. And I really wanted to impress upon him the importance of getting that solid start to the day. So I showed him the way that I organize my day, and then he wanted to try things his way. And of course, I was all on board for that. Absolutely. You give your way a whirl, and then we'll talk about it and we'll see what works, and we'll come up with the routine and a plan that works for you, because I'm not going to assume that my way of doing things is the only way to do things, right? So I was open to ideas and his him utilizing his own past experience to come up with his own routine. So he comes to me and he says, Mo, I'm going to try something today. I am just going to get in there right away, do my assessment, and bang it out early on in my shift. And I was like, okay, great. Why don't you do that? So we had 2 patients, and he started off his day just like that. He came to me around maybe 10 o'clock, and I'm watching all of this from the sidelines, making sure nothing gets missed, anything like that. And he comes to me around 10 o'clock and he is run ragged. The poor guy, he's like, oh my God, you were right. This day is chaotic. I'm going to go back to doing things the way you showed me. And what I had taught him was to do some prep work right at the beginning of the shift so that you basically kind of have, I won't go so far as to say a plan for the day, because as you know, nursing is very dynamic. It's very fluid. Anything can happen. Things change all the time, but at least a roadmap so that you can start your day basically knowing where it's headed. If things turn sideways, you can usually, hopefully, get them back onto track because you do have that map. So what I'm sharing with you today are 3 key things that if you do these at the very beginning of your shift, you're kind of setting yourself up for a less chaotic shift and having that roadmap so that when you do take a detour, you can find your way back. Sound good? Okay, let's dive into it. And this should not take forever. I realize if you're working on a med-surg floor, you could have many patients. Here in California, that would be 5. In other states, I don't know. How many is that? 6, 7? I don't even know. But I know it's a lot. And so you don't have time to sit and do an hour-long case study on each patient. But taking a few minutes to look up a few key things right at the beginning really will help. So, of course, you're going to get report. This is after you've gotten report on your patient. So take a moment. Sit down at the nurse's station or grab the nearest computer, maybe the one in your patient's room. That's fine. That's also a little bit helpful if you do want to just kind of keep an eye on your patient a little bit early on. If there's someone that you're a little bit iffy about, maybe they're, not so stable, you could just use the computer in the room so that you're keeping an eye on them as you do this. And that way you don't feel like you're missing anything. But here's what I want you to look at the very beginning of your shift. Number 1. Read the most recent physician progress note. If the patient's brand new, read the H&P. These notes will tell you a whole lot of information. It's going to tell you the patient's history, why they're here in the hospital, and really importantly, the plan. The physician will state, here's the plan. They're going to do this and this and this. They're going to go for this test. We're going to prescribe these medications to address all of these issues. Reading those notes takes a couple minutes, maybe, but it provides a wealth of information, really helping you get that big picture for your patient. The second thing that I would like for you to do is take a quick look at their labs. Not every single lab, and in some cases, some won't be relevant, but for the most part, here's what I'm looking at. If the patient has any risk for infection or any treatment for infection, like let's say they're in the hospital for an infectious disease like pneumonia, for example, I'm looking at the white blood cell count. I want to see how that is doing. Is it getting better? Hopefully. Is it getting worse? Hopefully not. So looking at the white blood cell count. I also want to look at electrolytes. Not all of them, unless they're severely out of whack, but mostly I'm looking for things like sodium, potassium, and magnesium. Those tend to be the ones that fluctuate the most in the clinical setting. And looking at, sodium, for example, too much or too little, you're going to have some neurological issues. Potassium, you're going to have cardiac issues. Magnesium, you're going to have cardiac issues. So I'm looking at those are the key ones. But if anything else is out of whack as you're looking through that list, of course, you're going to investigate that. I'm also looking at the blood glucose level. Just take a quick look at that. Most of the time it's going to be normal, but if your patient's receiving insulin, if your patient has a history of diabetes, if your patient's getting a corticosteroid, if your patient has an infection, the blood glucose could be elevated. I want to be aware of that. I'm also looking at their creatinine. I want to know about their kidney function. So many meds that we give can affect kidney function. Hypotension can affect kidney function. And kidney function can affect the clearance of medications that are renally cleared. So I want to know if they're having any renal insufficiency. And I'm also looking at if there's any risk for bleeding or a coagulopathy, anything like that. A patient who's had surgery, for example, I'm looking at their coags. I'm looking at all of those things that tell me how bleedy this patient could potentially be, like platelets, PTT, INR, things like that. With that, I also want to take a quick look at the hemoglobin, especially if they've had surgery or at risk for bleeding or have a chronic disease and maybe possibly have some anemia of chronic disease. So those are the key labs that I really want to know. Obviously, if there's something else going on with your patient, you're going to be looking at other things, but this is just the general stuff I kind of want to look at for every patient. And then I want to look at their medications and when they're supposed to be getting their medications. Generally, for the most part, there are set medication times in the clinical setting. There's like that 9 a.m. med pass, right? And then there might be something around noon or 1 or 2. But you still need to take a look, see what meds they are getting and what time, so that you can, kind of have a plan for the day, like, oh, he's got a 1400 med. I got to make sure I do that, like a 1400 heparin. So you want to make sure that you do that. And then you would also, hey, I want to know that this patient is on heparin because I am going to be looking at their coags and watching for signs of bleeding, etc. And that way, if I see a med that I don't know or don't know very well, I have time to look it up and be more familiar with it before it comes time to administer that medication. And once you've looked at this, and this really should not take more than a couple minutes, and as you get more adept at doing it, it'll come a lot faster and you'll be zipping around the chart like nobody's business. So don't feel like this has to take a really long time. You're not diving deep into the chart. You can do that later on in the day when you do have a little bit of downtime. But what we're trying to accomplish here is getting kind of a big 30,000 foot view of our patient so that we can start in our mind developing a plan. And you might use a run sheet, and I teach how to use a run sheet in my boot camp. And I've got an article on my website called How to Use a Run Sheet. I'll link to that in the episode notes. And this basically is kind of a loose schedule for the day. And once you kind of start having this overview of the patient, you can start planning out how you're going to get all of this stuff done, when other interventions are going to fit in, like a dressing change or getting the patient up and walking in the hall, things like that. So starting your day with intention and getting some key information about your patient before you go in and get sucked deep into patient care is really going to make a big difference. When you have that overview of your patient, you can start anticipating their problems and actively doing things to help steer them away from those problems. And also just having that, what my med-surg professor said was a high index of suspicion. Like, for example, if you've got a patient who just had surgery, let's say they had surgery, and they also have a coagulopathy, well, then I have a high index of suspicion that they could be bleeding at any given time, right? Let's say their platelets are very, very low. They've had surgery, and later on, they become tachycardic. Well, if I didn't know about these other things, I might first think, oh, maybe they're anxious or maybe they're a little dehydrated. But if I know these other things about the patient, that they are at high risk for bleeding, then I would have a high index of suspicion that they could be bleeding, and then I could gear my assessments toward that. So again, lots of stuff just to say, take a few minutes at the beginning of your shift to get a little bit more familiar with the patient, get that 30,000 foot view, get a few details about their labs and stuff like that so that you have all of this stuff going on in your nursey brain. And as you go throughout your shift, you'll be so much more confident in your ability to assess and intervene for your patients in a timely manner. So I hope that helps you. Have an amazing next shift. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Rinse takes your laundry and hand delivers it to your door. expertly cleaned and folded, so you could take the time once spent folding and sorting and waiting to finally pursue a whole new version of you. Like Tea Time You. Or this Tea Time You. Or even this Tea Time You.
So did you hear about Dave?
Or even Tea Time You.
So update on Dave.
It's up to you. We'll take the laundry. Rinse. It's time to be great.